Flu. Influenza, commonly known as the flu, is a highly contagious respiratory illness caused by the influenza virus. The flu is spread through the air by coughing or sneezing. It can also be spread by touching a surface or object that has the virus on it and then touching the mouth, nose, or eyes. What causes influenza? Influenza, or the flu, is caused by a virus known as influenza virus. There are 4 types of influenza viruses: types A, B, C, and D. Type A and B are responsible for most flu outbreaks and seasonal epidemics. Type C causes mild respiratory illness and is not a significant cause of widespread outbreaks. Type D primarily affects cattle and has not been known to infect humans. Influenza viruses can infect a wide range of animals, including birds, pigs, horses, and humans. These viruses are classified into subtypes based on the proteins on their surface. They are called hemagglutinin, H, and neuraminidase, N. There are 18 different hemagglutinin subtypes and 11 different neuraminidase subtypes. They can combine to create many different strains of the influenza A virus. The flu strains that are most likely to cause widespread illness and death are those that are new to the human population and for which most people have no immunity. Influenza B viruses are found only in humans and are responsible for less severe outbreaks. The influenza virus is primarily spread through the air by respiratory droplets when an infected person coughs or sneezes. These droplets can land in the eyes, nose, or mouth of a person nearby, or be inhaled into the lungs. The virus can also be spread by touching a surface or object that has the virus on it and then touching your own mouth, nose, or eyes. Once the virus enters the body, it attaches to the cells in the respiratory tract and begins to multiply, causing the symptoms of influenza. The virus can also spread to other parts of the body, leading to complications such as pneumonia or myocarditis. The symptoms of influenza, or the flu, include fever or feeling feverish/chills, cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, fatigue. Some people may also experience nausea, vomiting, or diarrhea, especially children. Symptoms typically develop 1 to 4 days after exposure to the virus and can last up to a week or longer. It's important to note that not all people with the flu will have a fever, and some people may only have mild symptoms. The flu is particularly dangerous for certain groups of people, such as young children, pregnant women, people with certain medical conditions, and older adults. Vulnerable groups. These groups are at a higher risk of developing serious complications from the flu, such as pneumonia, bronchitis, and sinus and ear infections. In severe cases, the flu can lead to hospitalization or even death. Influenza, or the flu, can cause a range of complications, some of which can be serious and even life-threatening. These include 1. Pneumonia. This is a serious lung infection that can lead to hospitalization and even death, especially in older adults, young children, and people with certain medical conditions. 2. Bronchitis. This is an inflammation of the bronchial tubes, which can cause coughing and difficulty breathing. 3. Sinus and ear infections. The flu can lead to secondary infections in the sinuses and ears, which can cause pain and discomfort. 4. Myocarditis and pericarditis. The flu can cause inflammation of the heart muscle and surrounding sac, which can lead to chest pain and other symptoms. 5. Neurological complications. The flu can lead to encephalitis, brain inflammation, or 6. Meningitis, inflammation of the lining of the brain and spinal cord, which can cause confusion, seizures, and other neurological symptoms. 7. Exacerbation of existing medical conditions. The flu can worsen existing medical conditions such as asthma, diabetes, and heart disease. 8. Secondary bacterial infections. The flu can lead to secondary bacterial infections, such as bacterial pneumonia, which can be life-threatening, especially in people with weakened immune systems. It's important to note that these complications are more likely to occur in certain groups of people, such as young children, pregnant women, people with certain medical conditions, and older adults. Therefore it's essential to take precautions and get flu shots to prevent getting influenza. What is antigenic shift and drift? Antigenic shift and antigenic drift are two mechanisms by which the influenza virus can change over time. These mechanisms can cause changes in the virus that can lead to new strains of the flu. It can impact the effectiveness of flu vaccines. Antigenic shift refers to a sudden and major change in the genetic makeup of the influenza virus. This can happen when a virus from an animal host, such as a bird or pig, acquires genetic material from a human influenza virus. This can result in a completely new strain of the virus that can infect humans and cause a pandemic. This is why influenza viruses are classified in subtypes H, for hemagglutinin, and N, for neuraminidase. It is because a change in the subtype means a change in the genetic makeup of the virus. Antigenic drift, on the other hand, refers to gradual changes in the genetic makeup of the influenza virus that happen over time. These changes can occur as a result of mutations in the virus and can lead to new strains of the flu. While antigenic drift can also cause new strains of the flu, it is generally less severe than antigenic shift and does not typically lead to pandemics. Efficacy. Both antigenic shift and antigenic drift can make it more difficult to protect against the flu, as the virus can change in ways that make current vaccines less effective. This is why flu vaccines are updated each year to take into account the latest strains of the virus. The World Health Organization, WHO, and the Centers for Disease Control and Prevention, CDC, continuously monitors flu strains and recommends the strains that should be included in the upcoming flu vaccine. What is the incidence of influenza among population? The incidence of influenza varies widely depending on a number of factors. They include the population being studied, the time of year, and the circulating strains of the virus. In general, influenza is most common during the fall and winter months in the northern hemisphere. During the spring and summer months in the southern hemisphere. The incidence of influenza is highest among young children and older adults. Children under the age of 5 and adults over the age of 65 are at greatest risk of severe illness and complications from the flu. The Centers for Disease Control and Prevention, CDC, estimates that the flu causes illness in 5% to 20% of the U.S. population each year. Hospitalizations range from 140,000 to 710,000 and deaths ranging from 12,000 to 56,000. It's important to note that these numbers are estimates, as the actual number of people who get the flu each year is difficult to measure. Many people who get the flu do not seek medical attention. Some people who have symptoms similar to the flu may actually have a different illness caused by a different virus or bacteria. Flu is considered a seasonal disease that can have a significant impact on the health and productivity of individuals in the population. That is why it's important to get a flu shot each year, to practice good personal hygiene and to stay home if you are sick. How is influenza diagnosed? Influenza is usually diagnosed based on a combination of symptoms, medical history, and laboratory tests. Symptoms of influenza include fever or feeling feverish/chills, cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, fatigue, and in some cases, vomiting and diarrhea. However, these symptoms can also be caused by other illnesses. So it's important to consult a healthcare provider for a proper diagnosis. To diagnose influenza, a healthcare provider may first take a person's medical history. It includes information about their symptoms, any recent exposure to sick people, and any underlying health conditions. They will then perform a physical examination, which may include listening to the person's lungs with a stethoscope. They check for signs of infection such as fever, inflammation, or congestion. If influenza is suspected, a healthcare provider may also order one or more laboratory tests to confirm the diagnosis. The most common test used to diagnose influenza is a rapid influenza diagnostic test, RIDT. It can detect influenza virus antigens from respiratory specimens. This test can provide results in a matter of minutes and it's used in point-of-care settings. Culture test. Another test is the viral culture test, which is more accurate but takes a longer time to provide results. This test involves collecting a sample of respiratory secretions from the person, such as a nose or throat swab, and then growing the virus in a laboratory. The virus can then be identified and its specific strain can be determined. The healthcare provider will also evaluate if the patient has any underlying conditions that could worsen the flu. They may recommend antiviral medication to reduce the severity of the symptoms and the duration of the infection. It's important to note that the flu diagnosis is usually made based on clinical presentation. Laboratory test results are not always available or may not be accurate in the early stages of the infection. How is influenza treated? Influenza is typically treated with a combination of self-care measures and medications. Self-care measures include 1. Getting plenty of rest. 2. Drinking fluids to prevent dehydration. 3. Using over-the-counter pain relievers, such as acetaminophen or ibuprofen, to relieve fever and muscle aches. 4. Staying home to avoid spreading the virus to others. Medications that can be used to treat influenza include antiviral medications. These medications, such as oseltamivir, Tamiflu, and zanamivir, Relenza, can reduce the severity and duration of symptoms if taken early in the course of the illness. They work by inhibiting the replication of the influenza virus. They are particularly recommended for people at high risk of complications from influenza, such as older adults and people with certain chronic health conditions. Steroids. These medications, such as prednisone, can be used to reduce inflammation and swelling in the airways, which can help to relieve symptoms such as coughing and difficulty breathing. They are typically used for people who are at high risk of complications from influenza, such as those with asthma or chronic obstructive pulmonary disease, COPD. It's important to note that antibiotics should not be used to treat influenza, as they are not effective against viruses. They should only be used if a secondary bacterial infection develops as a complication of influenza. It's also important to note that the flu vaccine can prevent influenza. It is the best way to protect yourself and others from the flu. It's especially important for people at high risk of complications from influenza to get a flu shot each year. What are the vaccinations available for influenza and how often they need to be taken? Types. There are several types of influenza vaccines available, including 1. An activated influenza vaccine, IIV. This vaccine is made with inactivated, dead, influenza viruses and is given as a shot. It is recommended for people 6 months of age and older, including pregnant women. 2. Recombinant influenza vaccine, RIV. This vaccine is made with a piece of the influenza virus, hemagglutinin, that is produced using genetic engineering and is given as a shot. It is recommended for people 18 years of age and older. 3. Live attenuated influenza vaccine, LAIV. This vaccine is made with live, but weakened influenza viruses and is given as a nasal spray. It is recommended for healthy people 2 to 49 years of age. 4. High-dose influenza vaccine, HDE3. This vaccine is similar to EF but contains 4 times the amount of antigen and is recommended for people 65 years and older. The Centers for Disease Control and Prevention, CDC, recommends that everyone 6 months and older should get a flu vaccine every year. Ideally by the end of October, although getting vaccinated later can still be beneficial. It's important to note that the flu vaccine needs to be updated every year to protect against the most recent strains of the influenza virus. The flu viruses change constantly and a new vaccine is developed annually. They protect against the 3 or 4 flu viruses that are most likely to cause disease in the upcoming flu season. It is also important to note that it takes about 2 weeks after vaccination for the body to build up protection against the flu. Also, people who have severe, life-threatening allergies to flu vaccine or any ingredient in the vaccine should not get the vaccine. The best way to prevent the flu is to get a flu vaccine each year. The flu vaccine is a safe and effective way to protect against the flu. It's important to get the vaccine as early in the flu season as possible, ideally before the end of October. In addition to getting vaccinated, there are other steps you can take to reduce your risk of getting the flu. These include 1. Washing your hands frequently with soap and water for at least 20 seconds. 2. Avoiding close contact with people who are sick. 3. Staying home when you are sick. 4. Covering your nose and mouth when you cough or sneeze. If you do get the flu, there are some things you can do to help relieve your symptoms and speed up your recovery. These include getting plenty of rest, drinking fluids to stay hydrated, taking over-the-counter medications, such as acetaminophen, Tylenol, or ibuprofen, Advil, to reduce fever and relieve aches and pains. Staying home until you are no longer contagious, which is typically about a week after your symptoms first appear. In summary, influenza, or the flu, is a highly contagious respiratory illness caused by the influenza virus. It's spread through the air by coughing or sneezing, and can also be spread by touching a surface or object that has the virus on it. Symptoms include fever, chills, cough, sore throat, body aches, headache, fatigue, and sometimes nausea and vomiting. The best way to prevent the flu is to get a flu vaccine each year. Take everyday preventive actions, such as washing hands, avoiding close contact with sick people and staying home when you are sick.